Well, hello, I'm Mark Miller, and I am a public health instructor for Southern New Hampshire University. I live in South Georgia, but have worked all over the country in public health, specifically in correctional health care in jails and prisons. Well, as the sun rises each morning in South Georgia, I show up at a prison, one of the county prisons, and I've done this in other states as well as a traveling healthcare administrator. So my day starts with seeing what patients within the prison need to be seen by doctors and nurse practitioners. Also, we have nurses provide a lot of care. As the health administrator, I'm responsible to make sure that these underserved populations within the prison get community level care. This is a really interesting job in that every day is different. While we have care given to people with chronic diseases and acute illnesses, and we even have an emergency room that deals with prison fights like you see on TV and sports injuries like we see in our neighborhoods. In a prison, it's every day's a little different. It seems like it would be a frightening place to work, but it really isn't, because these are people that have made bad choices in their life. Some are truly bad people who have murdered and committed horrible crimes, but the majority of the people have just made really bad choices and wound up in the correctional system. The one common thing that they all have is that very few have ever had health care. Having mental health care for depression, for substance abuse, having physical care for diabetes or COPD or other chronic conditions, or dental care for things as simple as a tooth rotting out. They just have never had access to that. And so I make sure that that care is delivered because they are wards of the state when they're in a prison, and it's society's responsibility and the state government's responsibility to make sure that they get the level of care that you and I would receive in the community. So every day's a little different. Staffing is always a huge part of my job as an administrator, in that I need to make sure that we have the right people, as one of my wardens used to say, the right people in the right seats on the bus, to make sure that we can deliver the care necessary. So we do a lot of training, a lot of skill refinement on young nurses fresh out of school, and older staff that tend to be end of career, who still need to learn a new skill. And you really can teach old dogs new tricks. And we do that a lot to meet the needs of our population. The current prison I work at is about 1,200 men. I have worked in prisons, male and female prisons over the years, and they're all very unique. The only common thing is that they're behind bars, and I get to go home at the end of the day, which is a good thing. And but the reality of it is they all have similar issues with things that we talk about in public health courses, social determinants of health. They were raised to think smoking was acceptable. Now, 20 years later in prison, they have COPD. They learned that eating fried foods every meal was going to be tasty, but have long-term effects on their heart, on their cholesterol. So we do a lot of patient education. We do a lot of damage control, but we also are challenged by the fact that prisoners can go shopping in a commissary and they tend to buy a lot of very unhealthy foods, and we can't control that. So much like the people in the community, my students in my public health classes deal with, we have to change a very old habits, and we can't always do that. So we basically make sure they're on the proper medication. We encourage exercise, which is possible in these settings, but we really do kind of make up for lost time in terms of their health care. As someone who earned a master's in public health, I see this as classic public health because we're seeing people of all ethnic groups, various religions, people who have abused their body with drugs, alcohol, cigarettes, and other drugs. And we have an opportunity to help them make better health choices for when they do re-enter society. And about 80% of the people we serve in prison are going to be our neighbors again. So what better thing to do as a public health professional than to help them get on the right road with their health. And then other areas of the prison we work closely with. There's schools in every prison. The one I work at has just been recognized for the most GEDs awarded in a prison in Georgia, which is fantastic because without education, as all of my students understand, without education, they have very few opportunities to be successful and not to repeat the same bad behaviors that got them incarcerated. Yeah, my advice for future public health professionals and healthcare administrators is corrections is a fantastic place to look at job opportunities. Sadly, in America, one thing that will not disappear is prisons. Because there are always people who make those bad choices, and rightly so. We need to protect people in the community, and that's the number one reason prisons exist, is to keep society safe. But while we're serving these people, there are needs for people interested in helping underserved communities. So people with a degree in public health, people with a degree in healthcare administration, people with degrees in social sciences, psychology, for example, do really well in this setting. I have been on the board of a public health department when I lived and worked in Missouri, and we can contribute a lot in community mental health, in community public health. And that's a very important thing too. There's a huge shortage of nurses and administrators in public health agencies. And a large part of that is the salaries are not very good. But you are doing an amazing thing helping people in the community, in the free world, as we say in my business, to access good health care. They were at the forefront of addressing COVID and have been in flu season and other times when the community needs a leader to step forward. So, but public health jobs in corrections can be held in state jobs. Most states run their own prisons. There are private companies, and I've worked for one, that run prisons and staff it and do all of that. But in the healthcare area, there are contractors, and I work for one now, that contract with the state to provide that health care. So there are jobs for new graduates. The preference is given to people with masters in either healthcare administration or in public health. My degree was a master's in public health with a concentration in healthcare administration. So I kind of check off both boxes. A lot of the physicians who come to work in corrections have an MD, MPH, so they get the aspect of public health in corrections. But there are clearly jobs in this field, backgrounds that are very beneficial are in social services, in business, because we have to be accountable for staffing models and for proper use of the funds that's allocated to us. But primarily we look for caring people who want to build teams of caregivers to meet unmet needs. So there are lots of job opportunities, and there's many companies out there that are always looking for people. If you're interested in working in a small community, most prisons are not in major cities. There are jails in every major city, but prisons tend to be put in rural areas. So I live in a very rural part of Georgia. I used to live in Houston, Texas, and it's a wonderful contrast. You don't have traffic and you have nice people in the country. So there are great opportunities in public health, in prisons and in public health agencies in smaller marketplaces. And it's great for raising families and for having a little less stress because, if you're considering healthcare jobs, it's a stressful industry, and we'd be lying to you if we didn't tell you that. But stress is okay as long as it doesn't become distress. So I want to encourage you to consider that. Feel free to reach out to me, and I can give you the names of some of the companies to look at. And I'm more than happy to guide you. I always offer to my students to be a mentor for them. And in correctional healthcare, I've done this for 7 of 25 years in healthcare administration. It's good. It's easy to know from talking with someone in the field if it's a good fit for you, but you need to know someone in the field. So if I can help you with that, reach out to me.